Hello everybody. Very happy to have you today online for these SPX talks in English. As you know, SPX is an important association, international association about patient experience, and I'm part of the board of directors and very happy to have you today. So today we'll discuss how we can improve patient experience with a digital tool. And I'm really happy to welcome Professor Fabrice Ferré, who is a medical doctor in anesthesia and resuscitation in the University Hospital of Toulouse. And to welcome Olivier Thuillart, who is a general director in bot design, which provides this tool. It's a bot, we'll see it, which improves patient pathway. So we go straight to the point to discuss how the solution improves patient experience. We have 20 minutes of presentations and we'll have 10 minutes of questions. We'll be able to answer your questions and then we'll give you a few information about the next steps for SPX. So maybe Fabrice, thank you again to be here, and I'll let you start with your topic.
Thank you very much, Céline. I'm very happy to be here. And if you are okay, I would like to share with you several slides on the digital companion. We developed a digital companion named Anesthesia that we developed for optimizing the care pathway of surgical patients. And I am also a professor in anesthesia, resuscitation, and perioperative medicine, and that is the topic today, the perioperative medicine. If we look at the surgical patient's healthcare pathway, there is a series of independent steps, like the surgical consultation, then several weeks after the pre-anesthetic consultation, then again several weeks after the surgery, and then the post-operative period. And the aim was to keep the link and to keep connected with the patient with that digital companion named Anesthesia, with three main components, three pillars: a pillar of education, a pillar of risk categorization, and the pillar of recovery. And if we look at the first pillar, we thought that between the surgical consultation and the surgical procedure, we have time to inform the patients. And we use that chatbot containing short videos and also several frequently asked questions. And we have demonstrated that the patients improved their understanding in their healthcare pathway, in particular in the domain of anesthesia, but also they reduced their preoperative anxiety. In fact, we use the Fabrice method, which is to ask them about their mental representation of anesthesia, asking the question, what are the three words that come to you in your mind when we hear about anesthesia? And before seeing the videos, the words was with emotional negative valence. And after seeing that kind of videos, and the words that come to their mind were words with and sentences with positive emotional valence. So we concluded that the anxiety, the preoperative anxiety, was reduced by that kind of education. Then we developed between the surgical consultation and the pre-anesthetic consultation a component in order to categorize the patient in accordance with their perioperative risk. And we use that time to collect the data and to establish some score, like, for example, the Abfeld score, the Stop-Bank score, or the Lee score, that are scores that are recommended by our Society of Anesthesia in France. And we demonstrated that collection was very reliable, and we established a digital risk score, a rule-based AI algorithm with 16 criteria in order to categorize patients with a code color like green for low risk of complication, orange for a moderate risk of complication, and red patient for a high risk of complication. And we demonstrated with a longitudinal study, including more than 500 patients, that score had a strong prognostic value, and that the patients that were categorized red with that digital score has a higher complication than the patient that was classified green. And the last component that I would like to share with you is the third pillar, and we use the postoperative period to collect the quality of recovery of the patients at day one, at postoperative day 1, at postoperative day 7, and at postoperative day 21. And with that chatbot that use a score validated in the scientific literature, like the quality of recovery 15, we demonstrated that we were able to collect the quality of recovery, and at day 1, the data collected was more interesting and more reliable than the phone call made by the nurses the day before the surgery, in particular in an ambulatory settings. So there is also a lot of results about the patient feedback, and the satisfaction of the patient using that chatbot was very high, and with a score of usability also excellent, considered excellent. And that's why since 2020, we use in our clinical practice routinely that chatbot to keep the link with the patient once again. So we talk about improved patient education. I talk about our ability to predict the postoperative complication with an excellent user satisfaction. We were able to collect data on their quality of recovery in order to reorganize the care pathway of our patient. And we think that kind of digital companion that we use to optimize the healthcare pathway of our patients is considered like a predictive medicine and also personalized medicine. Here we are. I have finished with my slide, and I'm free to answer to your question if you are okay.
Thank you, Fabrice. My question is, how did it change the consultation for the patient? Did it change something in your consultation? Did you have more time, or how?
Maybe first we can explain what was the difficulty you are facing, yes, Fabrice, with your patients, because when we talk about this project 5 or 6 years ago, we thought together that you have something like 60 patients per day to see.
Yeah.
And in each patient, you have something like 10-15 minutes to see them. And this moment, when we were talking about that it was very frustrating for you, both for you as a doctor and for the patient side, because we have no time to really discuss about the patient difficulty, right?
And also, we have no time to answer their questions, their relevant questions, because pretty all the consultation was to the aim of our consultation was to collect the data, like the past medical history or the medications, for example, and there only a little time was reserved to really talk with them and to answer to the questions. And with that companion, with that digital companion, we succeeded to collect the data before the pre-anesthetic consultation in order to prepare the consultation. So the consultation is the quality of our consultation improve, and we have time to answer to the questions and to discuss about the strategies of anesthesia we want to share with the patients. So our consultation is really different right now with that kind of support.
If I understand well, so you don't have to complete the questionnaire in the waiting room. You can complete at home quietly with your relatives, and then that's it. Then the HR is already completed, and you don't have to type on your computer. You have time to discuss with your patient, to chat with him, and to reassure them. That's it. Yeah,
it's a very important thing that you have just said. Is that the patient, when they do this memory effort, are at home with their relatives, and they have time to collect the data and to find their medical consultation, their post-medical consultation, in order to respond to the chatbot. And so the data we collected, the items we collected are really reliable and with a strong value, a strong medical value. And that kind of process increase the link between the patient and the relatives. So it's very interesting.
I have one more question. What is the difference regarding patient experience between this bot and a questionnaire that you would send at home? They're guided, it's more, is it easier for them, and how is the
as you can see, as you saw the results I present concerning the satisfaction and the usability, this chatbot and the question of these chatbots have been made with a person that is specialized in education and in human science. So the questions are really relevant and understanding for the patients. And also the added value is also that we are able to categorize the patient and to predict their outcome. And it is a very important thing because we can personalize their healthcare pathway. For example, green patients are eligible for teleconsultation, while red patients need to make their consultation in person and to be here, physically here with the physician, with the anesthetist.
And maybe, as you were spoken, maybe sometimes for red patient, it's going to be a difficult patient, so you can take more time to be sure, okay, I will take 15 minutes or 20 minutes for this patient because I know he has this kind of difficulty, so we'll talk about that. So it helps you to anticipate.
This is the real perspective of our works. It's to personalize the time of consultation for green patients, for example, 10 minutes, and for red one, for example, 20 or 30 minutes. Because we need more time for that frail patients.
So you organize your consultation in advance, and you can respect time and reduce waiting time for patients.
We prepare our consultation in advance. Correct.
Really good. And I suppose that patients prefer to be at home. It's more convenient than having to come to hospital for the consultation if they have low risk. That's it.
If they are low risk and if it's easier for them. And there is also an ecological impact to stay at home and to perform the teleconsultation. We have measured that in another study, and it's very interesting to know that this is interesting from an ecological point of view also.
And another point about that is even if I'm far away of a great center of hospital in Toulouse or in Paris, they have the same chance to be taken care of that patients are close to the hospital. So it helps that to reduce, the fact that I'm living far away from hospitals.
Even for patients that are far away, they are connected with medical experts, like in our university hospital. Not also in anesthesia, but also in other medicine, in other kind of medicine.
And what do say patients when they arrive at the consultation? Do they say, "Oh, it's really great, it's new, I never experienced it," or what do they say?
They say that, I saw you on the videos when I am consulting, and they are the majority of patients are really happy, are really because they participate to their healthcare pathway, and they improve their knowledge in anesthesia, and so they are familiar with the process, with all the pathway, so they like it. Really.
The patient the patient and their family, which is very important in this kind of pathway.
For the patient that need their relative.
Okay, I suppose that it's more interesting to answer a question with a bot that seems familiar than to answer a questionnaire with questions that are for everybody.
Of course. Of course.
Better. And I don't know if you have a few minutes more, Fabrice. I know you need to go maybe, but my next question was, what do you hope to achieve in the future, and what are your results at the moment? 2 questions in one.
Yeah. We need to demonstrate that the third pillar, the one with about the recovery, that is a new way to perform the anesthesia. It's the first time with that kind of support that we are looking for the patient after they come home, when they are in their environment, their ecological environment. It's the first time we've done that. So this is new data about their recovery, and I think that patients that we need to keep the connection with the patient even after the surgical procedure, and maybe for example to be able to detect the patients who are really painful after a surgery, in order to contact them and to adapt the treatment, the medications that they need. But we think also that with that kind of categorization, with red patient and green patient, that a personalized medicine, a personalized pathway can decrease the complication we observed in the postoperative period. So there is a lot of things to do again.
Yes, very interesting. We have 2 aspects. The first one is this bot that discusses with patients and that helps to prepare for the consultation in advance. And the other part is the stratification of risk, which helps to focus on patients who have special needs and to adapt. And very interesting because it's the basis of experience, I would say, of patient experience to be considered personally.
They are unique. A patient is unique, so we have to personalize our care.
Okay, very, very interesting. Do you have figures or results to share? I don't know.
Not figures, but maybe what we can talk about, because we started this project 5 years ago between COVID, because it was the best moment, I would say, because people cannot come to hospitals. So we started with into the Fabrice orthopedic service in CHU de Toulouse. So today now we have 5,000 patients that are using it at CHU de Toulouse and 30,000 in France. And because now the data we have, we can send them to Anesthesia logiciel. So then now for the doctor, they don't have to put data directly. All the data are fed into the to software, which is very easy for them in their use of technology.
It's a very important thing to improve the satisfaction of the physician. To develop that kind of we say in French interoperability. That the communication between software.
Yes.
Yeah, it's very important for us, and it works.
Yes, but we know that healthcare professional experience is linked to patient experience. They go together, so we have to work on both sides, and that's what you do.
And also because informatics, numerics, it's not the solution of everything. So that's why we have people. So support people are here to help the patient to go to the platform, to help them to connect. And what we saw in 5 years, that because there is a patient and also their relatives, and we saw that the percentage of patients are completing all the data is very increasing. Today we have 80% average, I will say, that complete the data before the consultation, which is a good rate, absolutely. And from all ages, I will say, young patient and older patient, because relative can do that for the older people also.
So I have a quick question. Sorry.
Yes, sorry, Celine. I have to leave you in a few minutes, and there is several questions for me.
Yes.
And I'm not sure that I
The first one is you're enthusiastic, so that's great. Yeah. Was it difficult to convince your colleagues? the value of this tool?
It's a very good question, and a very good question. And to convince my colleague, the thing we were talking just before about the interoperability is the key point. It's a very from a cognitive point of view is a mental charge to have a software, another one. So we have to connect the software together yes. To decrease the cognitive mental charge of my colleague. And my colleagues are right now enthusiastic also, like me.
Nice. You have to do it in other departments. I think.
Of course. Yeah. I have to leave. I'm so sorry, but
thank you, Fabrice. Thank you so much for your time.
My huge pleasure to be with you. Yeah.
Very happy to have you.
Thank you.
Yeah.
See you.
Bye-bye.
Olivier will continue. See you.
Yes,
soon.
yes. Bye
bye.
Sure. Okay.
Thank you again. And so, Olivier, we have 2 more questions. Has it been difficult to get legal approval to have a chatbot to categorize patients with some consequences for the treatment?
Yes, because this is the medical devices. So in that world, because as we said, the color we put to the doctor, so the color of the patient, green, orange, and red, it gives them a vision of the patient. So my algorithm need to be very good, because if I'm doing a mistake, especially for the green one, because the red one it will take it will take care of the data, but for the green one, the issue for me will be okay. They don't look at the patient file, and it could be a very difficulties. So my devices is a medical devices. So and we are class 2A. So for sure, my society but design is ISO 13485. We are certified by this, and yes, for sure, Anesthesia is medical devices. So it was difficult, but because we proved that, we did a lot of publication about our results, and yes, now it's okay.
It's like that. And another question is, who's paying for the patient companion?
So this is the hospital. Yes, because in this field, e-health, it's difficult to find business model, but yes. The hospital saw the possibility, to reduce patient anxiety and and also the doctor difficulties with this kind of data, with this kind of tool. So yes, today this is the hospital, and the next step for us is to have a reimbursement by Social Care of France, because with this kind of things, we helps for teleconsultation, we helps to have take care of difficult patient with a red label. So this is a discussion we have with the French authorities.
Especially if you continue to survey patients at home.
Absolutely. That's why we launched this new.
Okay. I don't know if there are another question. Maybe I can ask one. Did they measure that return on invest at the hospital? First question, and second one, did waiting time reduce in this department?
No time reduce. Because this is, and then there are differences between hospital and clinics. In France, I don't know if in other countries, but yes, I would say hospital public services. There's no time reduce, but as Fabrice said, mental reduction for the doctors, because when they need to take care of 60 patients per day. To be honest, it's difficult for them, and at the end, for sure, the attention for the last patient is less good at the beginning of the day. And as we talk, there's a lot of time lost. So I would say the quality and what we saw with the hospitals, for sure, that the right patient that can be saw before the hospitalization, yes, they can the amount for the patient is different. So with this kind of things, they can have some return of investment. And also, I will say of the quality of data, because we have the patient data from home and sent to the hospital. But yes, we improve that fact. And in the private field, yes, for sure, with this kind of tool, they can reduce time or taking care of more patients in one day, and facilitate for sure teleconsultation, which is kind of term reduction for sure, but more in the private part.
Okay, thank you. And one last short question, and then we'll conclude with the next step. How much time do patients spend with the chatbot?
Yeah, good question. Depending for sure of all the data of the patient, but it's something between 5 to 20 minutes for the patients. And for sure, they can do that in several times. They don't have to do it in one time. For sure, for all people with a lot of drugs, lot of previous operations, they need to fill in all the data. But and this is why when a chatbot is easier, because we can talk with him to say, okay, I will stop. I'm gonna start after. So it's easier than I would say a cold formulary.
Thank you so much, Olivier. Thank you again for all those information. Very interesting. I hope people will continue to discuss. Can people contact Olivier if they want more details?
Absolutely, yes. I don't know if you have my mail somewhere, but yes, if you go to botdesign.com, you can contact my company. Yes.
Okay, thank you again. And so a few information that you can find in the chat too. We would like to remind you of our next in-person event, the SPX Awards 2026 ceremony that will take place at Hospital Foch in Paris on April 16. Registration is free and open on our website. And after that, we will host the SPX Congress 2026, which is a very important event since many years now, from October 14 to 16. Early bird registration is now available on our website until March 3, so hurry up. We'll be happy to have you with us. And the call for authors is open, so if you have things to share, maybe you can. And it will be a great pleasure to have you. Don't hesitate to submit your presentation proposal before March 3. March 3. Again, but maybe, I don't know if you have a little delay for call for authors. Maybe it's March 3 or a little more. Joy or Lucy.
March 3. Yes, sir. March 3 is actually just to enjoy the early bird discount. You can submit then, I think it's until May, more or less. You have a bit of time, don't worry.
Okay. So we have 2 more minutes. I think that we answered everything.
I think there's one more question.
Question. Yes.
That's been added.
Any other medical areas beyond anesthesia where this is implemented? Good question too.
Yes, we put that into surgical pathway. The main idea is to prepare and to be there before and after hospitalization to maintain the quality of taking care of the patient. They are good. The taking care is good when you are in hospital, but before and after it's difficult. So yes, we did that for surgery to prepare the patient to have the best condition before hospitalization. And also we follow patient in oncogeriatry after hospitalization. We also follow in for SLA patients. It was, for sure, it worked a lot during COVID when the patient can't get to the hospital, and to be sure, okay, we will follow them. Yes, we have 10 specialties using this idea that chatbot can be there after and before to give global information. As a patient, I have a lot of questions about what will be my hospitalization, and then after, yes, the specific question that are medical devices.
Very interesting. I think it could be developed in each pathway because
absolutely.
It works for everything.
To have patient information before, to prepare the patient or to follow the patient. Absolutely.
Okay. So I think it's time to finish. So thank you again, everybody, to be here. Thank you again, Olivier and Fabrice.
Thank you, Céline.
And come and join us for SPX. You are welcome. Thank you. See you soon.
Bye.
Bye-bye. Bye.